Prehistoric and ancient medicine. Before 3000 BCE, prehistoric medicine primarily relied on a combination of natural remedies and spiritual practices. Evidence of early surgical practices, such as trepanation, drilling holes in the skull, indicates that early humans sought to treat ailments and injuries with rudimentary medical interventions. The ancient Egyptians were among the first to develop a systematized approach to medicine around 3000 BCE, utilizing a combination of herbal remedies, surgical techniques, and prayers. Medical texts such as the Edwin Smith Papyrus provide insights into their practices. Hippocrates and the Foundations of Western Medicine, 460 to 370 BCE. Hippocrates, often referred to as the father of medicine, revolutionized the practice of medicine in ancient Greece. He advocated for a rational approach to diagnosis and treatment, emphasizing observation and the study of the human body. The Hippocratic Corpus, a collection of medical texts attributed to him and his followers, laid the groundwork for clinical medicine and introduced the Hippocratic Oath, a code of ethics for physicians that remains relevant today. Galen and Roman medicine, 129 to 216 CE. Galen of Pergamon was a prominent Greek physician whose work dominated medical thought for over a millennium. He conducted extensive anatomical studies, primarily on animals, and developed theories on the circulatory and nervous systems. Galen's influence extended throughout the Roman Empire, and his writings became the authoritative source on medicine in both the Islamic world and medieval Europe. Islamic Golden Age and the Translation Movement, 8th to 13th century. During the Islamic Golden Age, scholars in the Muslim world made significant contributions to medicine. Prominent figures such as Avicenna, Ibn Sina, and al-Razi, compiled comprehensive medical encyclopedias that synthesized knowledge from Greek, Roman, Indian, and Persian sources. Avicenna's The Canon of Medicine became a standard medical text in Europe for centuries. The translation movement, centered in places like the House of Wisdom in Baghdad, played a crucial role in preserving and expanding medical knowledge. Medieval European medicine and the influence of the Church. 5th to 15th century medieval European medicine was heavily influenced by the Catholic Church, which emphasized the role of spiritual healing and care for the sick. Monasteries became centers of medical knowledge, where monks preserved ancient texts and provided medical care. The establishment of universities in the 12th century, such as the University of Bologna, marked the beginning of formal medical education in Europe. The curriculum was based on Galenic principles, and dissection of human bodies became more accepted for anatomical studies. The Black Death and public health responses. 14th century. The Black Death, a devastating pandemic that swept through Europe in the mid-14th century, had a profound impact on public health. The bubonic plague killed an estimated one-third of Europe's population, leading to widespread social and economic upheaval. In response, city authorities implemented quarantine measures, improved sanitation, and established hospitals to care for the afflicted. The pandemic highlighted the importance of public health interventions and set the stage for future developments in epidemiology. Renaissance medicine and the rise of scientific inquiry. 15th to 17th century. The Renaissance marked a period of renewed interest in science and the human body. Anatomists like Andreas Vesalius challenged traditional Galenic views by conducting detailed dissections and publishing accurate anatomical drawings, such as those in De Humani Corporis Fabrica. Paracelsus, another influential figure, promoted the use of chemicals and minerals in medicine, laying the groundwork for modern pharmacology. The invention of the printing press facilitated the dissemination of medical knowledge, allowing for greater collaboration and innovation. The birth of modern surgery. 18th century. The 18th century saw significant advancements in surgery, driven by improved anatomical knowledge and the development of new surgical techniques. John Hunter, a pioneering surgeon, conducted extensive research on the human body and emphasized the importance of scientific experimentation. His work laid the foundation for modern surgical practices. The introduction of anesthesia in the mid-19th century by figures like William Morton revolutionized surgery by allowing more complex and less painful procedures. The germ theory of disease. 19th century. The germ theory of disease, developed by scientists such as Louis Pasteur and Robert Koch, fundamentally changed our understanding of illness. Pasteur's experiments disproved the notion of spontaneous generation and demonstrated that microorganisms cause fermentation and disease. Koch's postulates provided a framework for identifying specific pathogens responsible for diseases like tuberculosis and cholera. This breakthrough paved the way for the development of vaccines, antiseptics, and improved hygiene practices, significantly reducing mortality rates. The development of vaccination, 18th to 19th century. The concept of vaccination was pioneered by Edward Jenner in the late 18th century. Jenner's observation that milkmaids who had contracted cowpox were immune to smallpox led him to develop the first smallpox vaccine. His work laid the foundation for the field of immunology. In the 19th century, Louis Pasteur built upon Jenner's work by developing vaccines for rabies and anthrax. The success of these early vaccines demonstrated the potential of immunization to prevent infectious diseases and protect public health. The birth of modern nursing, 19th century. Florence Nightingale, often referred to as the founder of modern nursing, transformed the profession through her work during the Crimean War. She emphasized the importance of hygiene, sanitation, and compassionate care, significantly reducing mortality rates among wounded soldiers. Nightingale's efforts to professionalize nursing led to the establishment of nursing schools and the development of nursing as a respected and essential component of healthcare. Her legacy continues to influence nursing practice and education today. The discovery of X-rays and medical imaging, 1895. The discovery of X-rays by Wilhelm Conrad Röntgen in 1895 revolutionized medical diagnostics. X-rays allowed physicians to visualize the internal structures of the body without invasive procedures, leading to more accurate diagnoses and improved treatment outcomes. The development of medical imaging technologies, such as computed tomography, CT, scans and magnetic resonance imaging, MRI, has further enhanced our ability to diagnose and treat a wide range of conditions, from fractures to cancer. The advent of antibiotics, 20th century. The discovery of penicillin by Alexander Fleming in 1928 marked the beginning of the antibiotic era. Penicillin's ability to kill bacteria without harming human cells revolutionized the treatment of bacterial infections, saving countless lives. The development of other antibiotics followed, transforming healthcare by making previously lethal infections treatable. However, the emergence of antibiotic resistance has become a significant challenge, highlighting the need for responsible use of these life-saving drugs and the development of new treatments. The establishment of public health institutions, 20th century. The 20th century saw the establishment of numerous public health institutions aimed at improving population health. The World Health Organization, WHO, founded in 1948, has played a crucial role in coordinating international efforts to combat diseases, promote health, and respond to global health emergencies. National public health agencies, such as the Centers for Disease Control and Prevention, CDC, in the United States, have also been instrumental in monitoring and controlling infectious diseases, conducting research, and implementing health policies. The development of modern medical education, 20th century. The Flexner Report of 1910, commissioned by the Carnegie Foundation, had a profound impact on medical education in the United States and Canada. The report criticized the quality of medical training and called for higher standards, including rigorous scientific education and clinical training. As a result, many substandard medical schools were closed, and the remaining institutions reformed their curricula to emphasize scientific rigor and practical experience. This shift laid the groundwork for modern medical education, ensuring that physicians are well-trained and competent. The discovery of DNA and the genetic revolution, 1953. The discovery of the structure of DNA by James Watson and Francis Crick in 1953 revolutionized biology and medicine. Understanding the molecular basis of heredity opened new avenues for research into the genetic causes of diseases and the development of targeted therapies. The Human Genome Project, completed in 2003, mapped the entire human genome, providing a valuable resource for understanding genetic variation and its impact on health. Advances in genetic engineering and gene therapy hold promise for treating previously incurable conditions. The development of modern vaccines, 20th to 21st century. The development of vaccines has continued to advance, with significant progress in the prevention of infectious diseases. The introduction of vaccines for polio, measles, mumps, rubella, and hepatitis B has dramatically reduced the incidence of these diseases worldwide. The development of the human papillomavirus, HPV, vaccine has the potential to prevent cervical cancer, and research into vaccines for diseases like HIV and malaria is ongoing. The rapid development and deployment of COVID-19 vaccines during the pandemic demonstrated the importance of vaccines in responding to global health crises. The rise of evidence-based medicine, EBM, late 20th century evidence-based medicine, EBM, emerged as a paradigm shift in medical practice, emphasizing the use of the best available evidence to guide clinical decision-making. Pioneered by figures such as David Sackett, EBM advocates for integrating clinical expertise with systematic research findings. The Cochrane Collaboration, established in 1993, has played a key role in promoting EBM by conducting systematic reviews of medical research. EBM has improved patient care by ensuring that treatments are based on scientific evidence rather than tradition or anecdote. The digital revolution and telemedicine. 21st century. The digital revolution has transformed healthcare through the development of electronic health records, EHRs, telemedicine, and mobile health applications. EHRs improve the accuracy and accessibility of patient information, enhancing care coordination and outcomes. Telemedicine has expanded access to healthcare, particularly in remote and underserved areas, by enabling patients to consult with healthcare providers via video calls. Mobile health apps and wearable devices empower individuals to monitor their health and manage chronic conditions more effectively. Personalized medicine and genomics. 21st century personalized medicine, also known as precision medicine, aims to tailor medical treatment to the individual characteristics of each patient. Advances in genomics, proteomics, and bioinformatics have enabled the development of targeted therapies based on a patient's genetic profile. Personalized medicine holds the promise of more effective and less toxic treatments for conditions such as cancer, cardiovascular disease, and rare genetic disorders. As our understanding of the human genome deepens, personalized medicine is expected to play an increasingly important role in healthcare.